Meanwhile, the Democratic Nursing Organization of South Africa has given their employer a 7-day notice to go on strike. It's despite it partaking in wage negotiations with government. DENOSA Deputy General Secretary Khaya Sodidi joins us for more on the story. Khaya, good evening. Thanks for your time. So what is DENOSA's position currently when it comes to these wage negotiations? Do you accept government's 3% offer?
Good evening, Katie, and to Newzroom Afrika viewers. No, Katie, as DENOSA and COSATU were not accepting the 3% offered by the employer. Also, Katie, just to correct that, we have not yet issued the 7 notice of the strike, but of course we can confirm that you are intending to do so.
Thanks for that correction. So what happens now that you don't accept this offer? What can we expect?
Katie, we are rejecting the offer, as we have indicated. If you may remember that we were in a conciliation last week, whereby the employer still adamant gave us the 3%. In fact, the employer went further by imposing the 3% to the employees unilaterally. So that has ended our members as a trade union. So therefore, we're not going to let that lie in. So we are going to, as I've indicated, that we are intending to issue a notice of industrial action. We are just busy now with consultation with our members, which we are hoping to conclude soon, so that we can serve the employer with a notice of industrial action.
The impact of nurses not going on strike and other staff in the healthcare sector that are affiliated with DENOSA will be absolutely critical for our healthcare services.
Of course, Katie, DENOSA in the Bargaining Council is working under itself, is working with the doctors, that means Samatu, and is also working with the SAIBU, the emergency personnel, and other union powers in the public sector. So if DENOSA declares a strike, then that will mean that automatically the doctors are working with and emergency personnel we are working with will be embarking on industrial action. And of course, with our sister unions like NEHAU, because we're working together in this industrial action under COSATU umbrella, and NEHAU and then police, group, and other unions are not affiliated to COSATU or affiliated to other federations are working together. So in total, all unions are working together to issue the notice together. Is 8 in total. So it will, of course, that will affect negatively public sector as a whole, and also that will spill over to other departments like safety and security, police, and then Home Affairs, and all other big departments which is in a house organizing under. So it's going to be a very big and devastating strike when we take to the streets.
These are also essential services that we're talking about, Khaya.
Yes, police have been declared as essential services. Of course, doctors have been declared as essential services. Nurses have been declared as essential services, and emergency personnel. So yes, I can confirm that in particular health, those I've mentioned that they have been declared as essential services in addition with the police.
Technically, those that are part of essential services are not really allowed to go on strike.
Yeah, we are aware of that, Katie. However, it is not going to stop us to apply and go on strike. The reason being that the Labor Relations, our Labor Relations Act, Section 72, is very clear that if you declare a particular department or a particular group of employees to be essential, you must, as an employer, with the employees, must enter on a collective agreement, which is called the minimum service agreement, so that those employees, when they go on strike, there must be agreed minimum staff left behind. So that has not been happening for the past 15 years. Employer has been, in particular in health, they've been running away to conclude this collective agreement. Because Katie and listener and viewers must remember that each and every employee in South Africa has got the right going on strike if it's not satisfied with the conditions and remuneration by the employer. Now, for not having that minimum service level agreement as provided by the Labour Relations Act, it deprived the same employees the right not to go to strike. So the issue of essential services, declared essential services, is old news coming, but the employer is doing nothing about it. The employer is running away, or they don't want to legitimize the strike of essential services. So we hear that, but we meet them on the street, and then our lawyers are ready to take that if they bring it, the issue of essential services. But as we speak now, the DENOSA, together with the unions I've mentioned and police, we have been issued a certificate to go on strike after we could not agree on the 31st of October and 1st of November in PSCPC in Centurion.
All right, let's leave it there for tonight. DENOSA Deputy General Secretary Khaya Sodidi.